This conference will now be recorded.
Good afternoon, everyone. Welcome to Whatcom County Health Department's media briefing for Thursday, February 4th, 2021. We are joined today by Erica Lautenbach, Whatcom County Health Department Director, and Amy Hockenberry, Whatcom County Health Department's Vaccine Planning Lead. We, like you, received notification that there is a governor's office press conference scheduled for 2:30 today. So we've shortened things up just a little bit so that we can all head off to attend that, as I'm guessing we all wish to. Also, just a reminder, we will post the recording later today on our media page at www.whatcomcounty.us/COVID, and it'll also be posted on the Whatcom County Government YouTube channel. We are still going to have a Q&A session at the end, but again, just a reminder, we will try to wrap that up by 2:30. So I'm going to just kick things right over to Amy Hockenberry to get us started.
Awesome, thanks, Melissa. So I want to give you all a brief update on where we're at with vaccines. As of this week, we're now up to 34 enrolled provider sites, so that's great news. Every week that seems to be increasing, and we still have several more providers that are in the pending application process. We're looking forward to seeing that number just grow over time. I'm going to quickly share my screen here. So I want to share a recent infographic. Just take a second here. So the health department will be, oh, I'll wait there, okay. Just, Melissa, can we confirm you can see my screen?
Yes, we can.
Yes. Okay, perfect, thanks. So the health department will be publishing this information now on a weekly basis. This came out yesterday, however, more data has come available, so we've updated it. So you're seeing the most recent numbers. And I'll just walk us through this. So on the left-hand side of this, all this data information is available on our dashboard, and we'll share that where that is at a later date. But for today, at the very top, our status for right now, we have currently 16,536 Whatcom County residents who have received their first dose, and that makes up about 7.33%. And then right below that, we have our Whatcom County residents that are currently fully vaccinated, so at 3,891, making up about 1.2% of our population. And I want to point out here that those percentages are based off of the full county population, about 225,000 individuals, and not just those who are eligible to get the vaccine, so those who are 16 and over at this point. And then the number at the bottom on the left-hand side of the infographic is our vaccine doses given to Whatcom County. This is the number that have been given by Whatcom County providers. That's 16,360. And the difference between these, right, is those two top numbers are of our residents, so they could have received their first or their second dose in a different county. And then on the right-hand side is the same information we've been providing on a weekly basis in these media briefings. So this is our allocations to Whatcom County. So for this week, we are getting 700 doses allocated to Whatcom County, first doses, and that brings us up to just a little over 14,500 doses being allocated, again, first doses to Whatcom County. Like I mentioned, a lot of this information is found on our dashboards, but we'll walk through that at a later date. So I'm going to stop there to keep it brief, and then I'm going to hand it over to Erica. She's going to unshare my screen, but she is going to touch on some of our other planning elements.
Thanks, Amy. Thanks for joining us, and I will try to be brief. We are hearing a lot from our residents, as I'm sure you are from your readers, listeners, or viewers, about vaccine. It's vaccine, vaccine, vaccine every day. And we understand and share the frustrations many are feeling. Unfortunately, largely the result of one bottleneck issue, which is the supply. And Amy so clearly articulated where we are, and we've really just scratched the surface in having the supply available for those, not only all residents, but those that are eligible. Many of if not all of the pain points will be decreased when the supply of vaccine is more in line with the demand, which is just not the case right now. I also want to share some of the focus and misconceptions about having a mass vaccination site. There are some misconceptions of the idea that if we had one of these sites, it would bring more vaccine to our community. That is not the case. It would really just make a thin supply even thinner. It would mean spreading the same number out so that there are even fewer appointments at any one provider, and more providers would have to cancel appointments if they didn't have enough vaccine. In contrast, the state-run mass vaccination clinics, which have been stood up to help sort of catch up some counties with high numbers of eligible residents, are using doses that would have otherwise been allocated to local providers across Washington state and do affect the supply in our community. If we stood up a mass vaccination site, it would not have that impact. We would not receive more vaccine in our community. Vaccine allocations vary from week to week, and each week we learn as a community how many doses will be available. It's not based on the number of doses requested by our providers. It is not clear how these allocations are made each week by the state. We've asked DOH to provide more information about how these decisions are made, and as you may know, our health board sent a letter to the governor and the Department of Health to seek more transparency on allocations between counties and within them. We hope to understand and have clarity on why some counties are receiving more vaccine than others, and why some enrolled providers within each county, including ours, receive some vaccine and others don't. We also hope to have more consistency in supply to our enrolled providers. We've heard that some weeks they'll receive 500 doses and they ramp up and add staffing and clinic hours, and then the next week they'll receive 0 doses. So for them, planning, staffing, and appointment scheduling is nearly impossible with these types of inconsistencies. So we're looking forward to learning more about the rationale and decision-making process around allocation. The health department, I also want to share, is working collaboratively with our large healthcare providers to plan for a large-scale community vaccine site that would be staffed and supported by a group of partners. This is, of course, incumbent upon more vaccine, as I shared, that having a large-scale community vaccine site won't bring more vaccine. We are pleased to announce that Bellingham Technical College and Whatcom Community College nursing programs will be participating in our large-scale community vaccine efforts. And we will share more details in the coming days about that partnership. Lastly, before we open it up for questions, I just want to give you a brief update on where we are with case numbers and exposure. After significant declines from a post-holiday peak in mid-January, 7-day case rates have appeared to level off in Whatcom County. However, our rates remain roughly double that of our counties in the region, and our relatively high rate is likely the result of just that continued community spread in the wake of our unique and really challenging post-holiday surge. Whatcom County rates within working age adults, particularly those aged 18 to 39 years, remain significantly higher than other age groups. We've also noticed that all sub-county areas within school district boundaries show promising declines in 7-day case rates. However, while the case rates in Linden and Nooksack communities have dropped rapidly from their post-holiday peak in mid-January, they now appear to be leveling off and are still at least double the rates seen in other communities in Whatcom County. So with that, I will close my comments and we will open it up for questions.
Thanks, Amy, and thanks, Erica. Again, we invite members of the media to type your name and affiliation into the chat, and I will call on you in the order presented there. One quick clarification detail. Amy mentioned that we have data, we are sharing data on the number of vaccines provided in Whatcom County by Whatcom County providers. And we just wanted folks to be aware that that includes both first and second doses in that number. Our first question is from Key Valia with the Bellingham Herald. Key, go ahead.
Thank you. Quick question, or actually two questions. Have you received a response yet from either the governor or the State Department of Health regarding the questions that you had sent in your letter? And then my second question is, when you're talking about the first and second doses in that first number, can you go over that part again? Thank you. And in the chart, I think it's, yeah, the chart. Thank you.
Sure. I'll quickly start with the first question, and then Amy can answer the second question. So just to clarify, that letter came from our health board, which is also our Whatcom County Council. I'm not aware of any responses they have received back, but we at the health department would have not have received the response directly, but I'm not aware that they've received one.
Yeah, and sorry for the confusion if I confuse folks. So I think I'm going to answer your question. Let me know if I don't. So we have basically two numbers. We have the numbers of people, the individuals, our residents, total number and percentages who have received first and or second dose, and then our total number of vaccines received within Whatcom County. So that those are the vaccines that have been provided by Whatcom County providers. So that's that bottom number that was on that infographic. So let me know if I did not answer your question.
That was fine. Thank you.
Okay, our next question is from Keith Eldridge with Como TV. Keith, go ahead.
Hi, thanks for taking the questions. It goes along with what Key was asking about. So I know it comes from the health board or the county council, but the letter is pretty pointed, asking that Whatcom County and the other counties in the regions all be allowed to go to phase 2. Do you support what the health board has said in asking the governor to do that?
I guess I want to nuance this because the intention is to move forward safely and to move forward as quickly as we can. What we recognized and what the health board recognized in the decision last week to move some counties forward was that there were cracks and inconsistencies that began to show about the rationale for moving certain counties with high case rates forward and other counties with high or lower case rates staying in shutdown, essentially. So that was the concern. Is it doesn't feel as though the logic and rationale around moving counties forward because they've experienced decreases in case rates without having a benchmark is a rationale that we can justify and explain to residents in our businesses. So for example, in our region, Island County was in phase 3 in the Safe Start plan. They advanced all the way to phase 3. They have sustained low rates, but because they didn't see the kind of decreases that other counties did, we as a county, as a region, weren't able to move forward. And so that's the inconsistencies that feel challenging, right? That if a county moves from phase 1 to phase 2 because they saw drops from 500 to 450 cases per 100,000, but a smaller county like San Juan or Island is staying put because they did not see decreases, even though their baseline is 25 or 50 cases per 100,000. That's hard for folks to understand because their disease burden is lower as a baseline. Does that make sense?
Yes, thank you.
Thanks, Erica. I don't see any other questions in the chat, but we will pause here for just a moment to see if there are any. That always works. I do see that we have a question from non-media folk. I just want to be clear that this is primarily for members of the media to ask questions. I will connect with you, Robert, to find out what your question is, and we can answer that a different way for you. Our next question is from David Rasbach with the Bellingham Herald. David, go ahead.
Hey, Erica. appreciate your time again. Obviously, people are seeing numbers of how many vaccines we're getting here in Whatcom County. If we got 700 vaccine doses this week and the state had 107,000 doses, that's less than 1% of what the state was allocated this week. Have they given you any reasons for why our vaccination number has been so small when Whatcom County represents about 3% of the state population?
Yeah, those very questions are what we're trying to get to the bottom of with the state. And unfortunately, until we have that transparency and understanding, it's really hard to explain any of this to residents and to your readership. We don't know what the decision-making process is for allocating by county. We know that surrounding counties, some of our neighboring counties received nearly double what we received and have smaller populations. So it's not based on population size. We don't believe it's based on the number eligible in the current 1A and 1B1. But that's what we need to learn, and that's what will help us all understand and have a little more predictability about what to expect from week to week from our state.
Thanks, Erica. Next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, thanks, Melissa. This question is for Erica. You mentioned earlier about continuing community spread from the holidays. And I think in the last press conference, you mentioned that COVID cases couldn't be traced specifically to restaurant dining. But I wanted to ask a couple more questions related to that. Does this, you said they couldn't be specifically linked to restaurant dining, but that 80% of positive cases could be traced to social or family gatherings. So first question is, does a social gathering carry the same infection risk as dining in a restaurant since patrons remove their masks to eat? And the follow-up to that, do you think that Whatcom County's infection rates are now low enough to allow for a return to restaurant dining of at least some level? And indoors.
Yeah, Amy, please jump in. I'm going to share sort of what we know, and I think you're asking me to prognosticate, and I will do my best to not do that, but share what we know.
Okay, thanks.
So what we know is spread occurs when 4 conditions are consistently met, which is, the first is time together, time in close proximity, time without masks, and you know, just being indoors, spending time together, not wearing masks, and being in close proximity. Those are the ingredients that contribute to transmission, right? So whether that's in a person's home or whether that's in a public space, if people are in close proximity, not wearing masks for a period of time indoors, that creates the opportunity for transmission. That said, there are differences between controlled environments like restaurants and uncontrolled environments like people's homes, right? You know, generally, there are limitations on the number of people that can dine at one table together. And the spread between tables is minimized by having tables spread apart. There are also, you know, regulations in place that if people stand up or they're not at their table, that they have their mask on. And those controls help somewhat minimize the spread they do help minimize the spread amongst different dining patron tables. But amongst the tables that are, the people that are sitting around one table together, that has the same sort of opportunity for transmission. Whereas in people's homes, you could have 20 people in a room, all tightly packed together, not wearing masks for hours. And that's where the controlled versus uncontrolled becomes really important.
Yeah.
So I guess like that, just from a science perspective, that's, you know, there's no way to eliminate the risk of transmission in a place like a restaurant, because if people do dine with people outside their household without a mask together at a table, there is the risk of transmission. But they at least have enough controls in place that they can minimize the spread between various tables. So, Amy, do you have anything else you want to share about that or add to that on the data?
No, the only thing I mean, I would just double down what you just said as far as the opportunity for people to dine together from outside their households in something that would be in relation to a social gathering. Again, people from outside each other's households or from their households joining together. So it's the same level setting, just the same setting and risk of transmission that Erica was describing.
Yeah, okay. Thank you.
I believe that that is all the questions we have. One last call for any other questions, and if not, I think we will go ahead and close things out for today.
Thanks all.
All right, thank you everyone. Reminder, we are doing a town hall event at 5:30 tonight. You can find that information in the media advisory we send out or on our Facebook page.
Great. Thanks, Melissa.
Take care, everyone.